Hi, my name is Professor Kaopui Vincent Wong, Professor of Mechanical and Aerospace Engineering at the University of Miami in Florida, USA. I'm here to talk about a couple of my health, nutrition, and disease papers. Today, I'm focusing on my papers about microcephaly, Zika. I've written two papers, Zika and risk factors of microcephaly, to be published in the Journal of Epidemiology and Public Health Reviews. The Zika risk factors, the microcephaly risk factors include Zika, but not only Zika. They have been known, they are published by the Mayo Clinic. They have been listed in Wikipedia. Almost half of them listed in Wikipedia are genetic in origin. So in my paper, I have gone through and discussed the possibility that a high percentage or a lot of the cases in the northeast Brazil could be also not only due to Zika plus the genetic makeup of the peoples of that region. Zika, by the way, Zika and the other risk factors could cause microcephaly. Zika takes place in men, for instance, and many of them do not have any symptoms. However, microcephaly has been showing up since the time of Hiroshima and Nagasaki after the nuclear explosion bombs after the Second World War, or during the Second World War. There were microcephaly babies found after that from nuclear radiation. Microcephaly also occurs whenever when there's Down syndrome. Two factors that need to be examined is about the practices of the pregnant mothers. One is the drinking of alcohol, and two is the taking of drugs, even unintentionally, like drinking coca leaf tea, as is done by many natives in South America. These two practices are risk factors for microcephaly. So there is a strong suspicion, at least in my view, that with these two risk factors and with the presence of Zika infection, microcephaly can be a big problem. So be sure to read these two articles in the Journal of Epidemiology and Public Health Reviews. I just want to end this little video by talking about a couple more of my papers published in the Journal of Epidemiology and Public Health Reviews. These are regarding Nasopharyngeal carcinoma, and this particular disease has been researched to great detail by the Southern Chinese. So the main point there is that I believe it was a practice by the Cantonese people to wean their babies on salted fish, salted cod, in the absence of vitamin C. So this is not a very good practice because this salted fish and kanji, for instance, or rice porridge, together are not adequate enough for weaning a baby. They need vitamin C if they insist on eating the salted fish. So thank you for listening, and always remember, do not forget your vitamin C after every meal. These are Florida oranges. Vitamin C after every meal.